Hi everyone, this is Caitlin Fortenberry, and today I will be elaborating on healthcare delivery system in relation to equity. What is healthcare? Healthcare delivery system represents a complex network of interconnected organizations, people, and resources working together to provide essential healthcare services to populations. This intricate system plays a crucial role in managing population health through coordinated efforts of various stakeholders. The many components include hospitals, clinics, physicians, nurses, pharmacies, insurance companies, public health agencies, community organizations, and patients themselves. These components all interlock and rely on each other to provide comprehensive care to patients. The interlocking provides very efficient ways to share patient data, treatment standards, research results, resources, and any information about staff with the healthcare system. Partnership with community organizations can address social determinants of health like access to healthy food and housing, which impacts population health. By analyzing this data on a population level, the healthcare ecosystems can identify trends and target interventions to address specific health needs of a community, which promoted preventative care and early detection of any diseases of the population. Social determinants of health impacts individuals and public health outcomes by influencing factors like access to healthcare, nutrition, housing, education, and employment. The CDC 2024 states that addressing differences in social determinants of health accelerates progress towards health equity. Social determinants of health includes the effects of centuries of racism, which are key drivers of health inequities within the community of color. This factors like poverty, lack of access to healthy food, and unsafe neighborhoods can directly contribute to increased rates of chronic diseases, mental health issues, and premature death. Understanding the system is vital as it directly impacts individual and public health outcomes, address health inequalities, and it carries significant economic insinuations, and it also influences policy expansion and employment. And over here, this picture just basically elaborates on healthcare as a whole. The providers, post-acute facilities, Hospital B, Hospital A, which, all your hospitals in a community are integrated, and any independent providers, such as like private-owned clinics. How do healthcare providers have an effect on inequity? So, our providers in healthcare include physicians and non-physician providers, our nurse practitioners, physician assistants, which these all work under all physicians and provide treatment to any person in need. Healthcare providers form the backbone of the system, with physicians serving as primary care providers and specialists. However, significant distribution disparities exist in underserved areas, creating gaps in care accessibility. Non-physician providers include nurse practitioners and physician assistants play an increasing part of role in expanding to healthcare in underserved areas. When addressing any healthcare disparities in underserved areas, primary care physicians face significant distribution challenges, while non-physician providers like nurse practitioners and physician assistants play a crucial role in expanding access by becoming more likely to practice in the underserved communities. In the journal by Walters, 2023, it was stated that filling the gaps left by physician shortages, the non-physician providers can provide primary care services to underserved communities. Allied health professionals, particularly nurses who treat patients per physician orders and advocate for effective population, and therapists who provide counseling outreach, further strengthen the healthcare workforce. So this map right here just basically shows the provider insufficient staffing in rural areas, which most of these rural areas have a greater healthcare disparity effect through that population. So, how do providers create inequity? by geographic maldistribution, as shown right here, cultural barriers, and they implement any bias in care delivery. So, provider impact on equity manifests in both creating and addressing disparities. Geographic maldistribution, cultural barriers, and any bias in care delivery contribute to health inequities. However, the healthcare system has begun addressing these issues through cultural competence training, increase diversity in healthcare workforce, and utilizing community health workers to bridge any gaps. A provider's impact on equity can significantly contribute to creating inequity through factors like geographic maldistribution, any cultural barriers, and any bias in healthcare. When healthcare providers concentrate on certain areas without including the underserved areas, this results in poor health outcomes for those populations. The lack of language translation services or culturally sensitive care, it can create any barriers for patients with any diverse backgrounds, which in return can hinder effective communication and understanding of treatment plan for that patient. While physicians can be unconsciously biased, it can influence treatment decisions, which leads to disparities in diagnosis, treatment options, and overall quality of care based on factors like race, ethnicity, or socioeconomic status. So, with proper education for providers on culturally sensitivities and communication strategies to effectively interact with patients from diverse backgrounds, McGregor et al. 2019 stated that cultural competence training initiatives for integrated care settings must leverage the work of um, coalitions and governmental agencies that can provide technical assistance resources and any expert advice and guidance that will encourage adoption by all providers and staff. Increasing the representation of different racial, ethnic, and any groups within healthcare teams to better understand and cater to the needs of diverse patient populations. Also, the utilization of individuals that are deeply rooted in the community to act as bridges between healthcare systems and any unserved populations, which can facilitate access to care and addresses any social determinants of health. What exactly is a healthcare setting? So, as shown below, we have primary care, secondary care, and tertiary care. So, these three healthcare settings can range from um, an urgent care to hospitals and to any school of medicines for academics. Healthcare settings vary in complexity and accessibility. Primary care settings include private practices, community health centers, and urgent care facilities, and this forms the first line of healthcare access. Secondary care settings encompass hospitals, specialty clinics, and ambulatory surgery centers, while tertiary care is provided through academic medical centers and specialized hospitals. These settings can either create inequity through location and accessibility issues, cost variations, and service availability differences, or it addresses through mobile health units, telehealth services, and community-based initiatives. So, what is healthcare settings' impact on equity? We have the creating and the addressing. So, when discussing healthcare inequity, it creates inequity refers to factors like geographical barriers to access, varying cost of healthcare services, and differences in the availability of services across different regions. When healthcare facilities are not readily available in certain areas, particularly in rural regions, which limits access for residents in the community. Significant price differences in healthcare services due to any insurance coverage or any out-of-pocket costs can prevent patients from accessing any necessary care. Disparities in the types of healthcare services offered depending on location, which could potentially lead to an unequal quality of care. So by addressing these factors, there could be a mobile clinic to reach underserved communities in remote and underserved area where fixed providers are lacking. By utilizing this technology to deliver healthcare remotely, this would allow patients to consult with providers virtually and overcoming that geographical barrier. Williams et al. 2019 found that numerous progressions in technology have occurred, which create vast occasions for patients as well as providers to manage and direct care in real time, share clinical and interactive data, and collaborate to reduce disparities. Healthcare purchasers. We have many healthcare purchasers in the United States. We have any private insurance, which could be employer sponsored, individual market, or coverage disparities. And then we have the government programs that bridge this gap. We have Medicare, Medicaid, and then other programs such as CHIP, Veterans Health Administration, and Indian Health Service. Healthcare purchasers significantly influence healthcare access and equity. Private insurance, whether employer sponsored or individual purchased, shows notable coverage disparities by race and ethnicity. Government programs like Medicare and Medicaid play crucial roles in reducing disparities through state variations in Medicaid expansion, which creates geographic inequities. Other programs such as CHIP, Veterans Health Administration, and Indian Health Service target specific populations. These specific populations include the underserved and minority of populations that do not have access to healthcare. Artiga et al. 2024 described that statistical data has shown continual disparities in coverage rates, particularly affecting Hispanic and African American populations. With governmental programs, this increases the expansion of healthcare cost across the underserved areas, and individual purchasers face challenges related to out-of-pocket spending, including direct payments and health savings accounts. The financial burden varies meaningful across populations. It creates barriers to access, delayed care, and medical debt disparities. Healthcare purchasers are addressing equity through insurance reform, including coverage expansion, network requirements, and cost sharing reductions. Government initiatives such as Medicaid expansion, subsidy programs, and special population programs further support these efforts. And recent data from the Kaiser Family Foundation demonstrates persistent racial and ethnic disparities in health coverage, while the CMS National Health Expenditure data reveals the growing financial burden of healthcare. The Future Nursing 2020 to 2030 report emphasizes the critical role of nurses in achieving health equity, and research published in the American Journal of Medicine Science highlights both opportunities and challenges in achieving equity in evolving healthcare systems. Williams et al. Also stated the relative importance of insurance coverage and income and community medical care resource differs from ethnicity, with the lack of health insurance being a significant access barrier for Hispanics, but less so for African Americans. So what exactly is the insurance role in addressing equity? So they the government has came up with some plans, such as insurance reform and then government initiatives. So, while government health programs aim to provide broad coverage, disparities in access and quality of care across all racial and ethnic groups, the healthcare delivery system continues to evolve, which increasing focus on addressing inequities through systematic changes. Success requires coordinated efforts across all components, providers, settings, and purchasers, which is supported by the evidence, policies, and sustained commitment to equity. As healthcare costs continues to rise and disparities persist, understanding and improving this complex system becomes increasingly crucial for ensuring equitable access to healthcare for all populations. So this basically just shows that making plans a reality. The government has really put into place any expansion for coverage, any cost sharing reductions, and any expansion for the underserved area that does not have health care. So you can see that prioritizing health equity programs is at an 89%. Um, w- we want to address funding and reimbursement challenges. They have a specific budget, and that securing funding is a barrier to addressing health equity, and that site reimbursement issues with health insurance such as Medicaid or Medicare. So essentially that by creating these reforms or plans and goals for the underserved areas, especially um, the ethnicity barrier that the United States has created, um, by really accepting these, like I said, these reforms and initiatives, it really brings the underserved areas together by incorporating healthcare for all of those specific populations, which is very crucial in addressing any equity in the United States. And then this is just my reference page. I cited all of the articles that I found all of this information from. Thank you.